Hey everybody, welcome back to the channel. My name is Kelly Troutman. I'm a certified hand therapist. In today's video, I want to show you how to use coban tape to help with a swollen finger. So if you or someone that you know has had a hand injury, they are feeling really swollen, especially these like little stubborn PIP joint injuries. Even after they've healed, sometimes we still have a lot of swelling. It's really hard for the fingers to kind of flush that swelling out. The little vessels are just super tiny, so it's hard for our swelling to kind of get pumped out. And in addition, our hand is always below our heart level, right? So it's real, we don't usually walk around with our hand elevated all the time, so there's just no way for gravity to even help out with that. So I'm going to show you how to use coban tape to help reduce swelling in your fingers. So let's get into it. All you need to help reduce your swelling with this technique is coban. I like the 1-inch size. They do also have it usually in a 2-inch roll, but I think 1 inch is perfect, and a pair of scissors. So first you'll take your coban roll and you're going to cut a little piece off of it. You'll notice that the coban is very elastic, and as you stretch it, taking it off the roll, it actually helps to activate some of the glue so that it'll stick to itself. So we've got our little strip of coban. You can kind of play with how stretchy it is. When you're doing this technique, you actually don't want to stretch and then wrap, because if you do that, it's actually going to be too tight and it's going to cause circulation to be interrupted to the finger, so it's not going to help with your swelling at all. To help assist with swelling, we actually only need a very small amount of compression or pressure, and so you don't want to pull it really tight. You're just going to actually lay it over the finger. So I'm going to demonstrate, let's see, I'll probably demonstrate on this hand, on my index finger. And what you'll do is you'll start kind of at the very tip of the finger, leaving your fingertip free, and then wrapping around in a diagonal fashion around the finger. So you'll notice that I'm not pulling and then stretching. I'm just laying the tape down with like a half cross or like a little diagonal over the finger. Sorry, this is hard to do on film at the same time. And then the nice thing about this coban or Coflex is that it sticks to itself. So you can kind of just gently press on the tape, and can you see how it has all these like nice little layers around the finger? Sticks to itself. It's also flexible, so you can still bend your finger. So it's something that you could wear during the daytime to help kind of maintain that compression around the finger, that light circumferential pressure, help with the swelling, but you're still able to be flexible and do movement. You'll notice that it's hard to get all the way down, so it's not something you want to keep on all day long, but it can really help. And you always want to leave the tip of the finger open so that you can make sure that you're not getting purple, which would indicate that the tape is too tight. So that's what the end product looks like, just to give you another view. I hope that video was helpful, and if you try this method and it works for you, let me know. It's pretty easy, it's very low cost, and sometimes it can be really effective in helping with swelling in the finger. The nice thing too to remember is that coban is actually reusable. So if it gets wet, it's not going to really work out too good, but you can keep these little pieces and you can keep reusing them until it doesn't stick anymore. So it's nice and easy. You can easily do this on yourself. Maybe not easily, but just wrapping around. Thank you guys so much for watching. I hope you enjoyed this video. If you did, please give it a thumbs up. If you're not subscribed, go ahead and hit that subscribe button now if you want more information about hand therapy, diagnoses, and topics. and I'll see you all in the next one. Thanks.